Today's healthcare system is changing so rapidly. That's why there's a new breed of patients who are taking steps to empower themselves to proactively manage their own health. Qualidigm, the founders of Connecticut Partners for Health and Primacy, are encouraging both patients and healthcare providers to attend the Better Health Everyone's Responsibility Conference on September 17th at the Connecticut Convention Center. Joining us now are Ann Elwell, the Vice President Community Relations for Qualidigm, and Dagmara Scalise, Associate Vice President, Healthcare Practice Lead, Primacy. It's great to have you both with us.
Thank you.
Let's talk about who should be going to this conference.
Everyone should be going to this conference. If you are a consumer, a provider, you should all go to this conference. And we can't forget that providers are consumers of healthcare as well.
So why is that so important, though, that they need to be there? What kind of information are we going to be talking about?
Pretty much a wide range of information about planning for your health, taking control of how you interact with your providers, about how you get informed about healthcare. So really trying to get at the crux of kind of the issue of being a very engaged patient.
When we say an engaged patient, what should they be doing? I mean, specifically, when they walk into their healthcare provider?
They should go in armed with information, with not just questions, but they want to participate with their clinician on making decisions about their own health care. You know, one of our keynote speaker, his name is E-Patient Dave, we call him, and he is a cancer survivor, but he will tell you that the most underutilized resource in the healthcare industry today is the patient.
So when you walk in, should you have a list of questions? What should you have with you?
Yeah, I mean, I think questions are a good place to start, but as Ann said, being informed and being aware of what you are actually empowered to do. So to feel more comfortable about the idea that you can maybe talk to your provider directly and not feel like you're only a recipient of information. I think having that open attitude is really important. So questions and open attitude, and also reading about, you know, better health, understanding some of the rules that are changing now in the healthcare marketplace. Those are all really important components.
So are you seeing not enough consumers are doing this?
I think that it's getting a little bit better, I think, but I think that our society has encouraged patients to have health care done to them rather than participating in it. And I think even the providers now really want patients to work with them on managing their own health care. It's not just the provider's responsibility. It's your health. It's your responsibility.
So will healthcare providers spend more time with their patients? Is that what we're going to be seeing?
Well, ideally, we'd love to see that, but you know, our healthcare system is changing, and hopefully we will be more apt to pay for providing quality care rather than volume care like we are at now. And I think an engaged consumer will help the physician move things along in the discussion.
Let's talk about the changing world of healthcare. Obamacare coming up. Is this another reason why you're holding this conference?
Yeah, I think Obamacare is definitely changing the entire landscape of healthcare. It's changing how providers are being reimbursed. It's going to enable more people to have far more healthcare coverage. But I think in addition to that, I think this is an environment with technology that really enables providers and patients to engage in very different ways. So, for example, there are a lot of apps that you can have on your smartphone, for example.
You see them pop up all the time now.
Absolutely. They can help you track your chronic conditions. They can help you track your medication. They can tell you about your wellness. You can track your steps or your weight or your blood pressure. All sorts of things on the consumer side. And then there are lots of technologies on the provider and the hospital side as well that are enabling people to connect better and get more information.
Well, let's talk about what the healthcare provider will learn at this conference.
Oh, I think there's many techniques about communicating with your patients, really talking about, one of the things that I'm excited about is motivational interviewing. It's really talking about not why a patient should do what someone is telling them to do, but really why should the patient do it for themselves? What are their goals? So why would improving their health care help them achieve the kind of life they want?
You have all kinds of sessions all day long.
All day.
What are some of them that people really need to look at?
Well, we're going to be doing a few different sessions on emerging technologies in healthcare. I think that'll be important. There are other topics. I think we have some on medication
management, communication, technology, the Affordable Care Act. You know, everyone talks about the Affordable Care Act, Obamacare. Just what is it? What does it mean for you? What does it mean for clinicians, providers? So I think important information. We have a new healthcare exchange and health insurance exchange, and let's have people know about that, know about their options.
That's right. I've been doing a lot of stories on that, and even then, there are still people out there who are not quite clear about what that's all about.
That's right. I mean, we talk about health care, we talk about health, and knowing your insurance and what you are supposed to do and how to go about arranging the things you need. That's why it's important to come to this conference.
Before also, I want everybody to know more about what primacy is. I'm intrigued by this, Dagmara.
Yes, so we're a digital agency. We were founded in 1994. We're based in Farmington, and we also have 2 big city offices in Boston and New York. But we work with a lot of healthcare providers. We work with hospital systems, Yale New Haven Health System. We work with Middlesex Hospital. We work with Connecticut. So we get a lot of insight into what is going on with the healthcare industry and how we could potentially improve the experience both on the patient and the provider side through technology.
So that's why you've hooked up with Qualidigm.
Yes.
And Qualidigm and?
Yes, in Qualidigm. Well, we are a healthcare consulting company located in Wethersfield, Connecticut. We have for over 30 years been really dedicated to improving the quality, safety, and cost effectiveness of healthcare. And like Dagmara, we work across the healthcare continuum, physicians with nursing homes, hospitals, home care, community-based organizations.
All right, and that event again is on, let's get the information on the screen for everybody. It's Better Health, Everyone's Responsibility Conference happening on September 17th at the Connecticut Convention Center. Tickets are $10, parking free. Register today at ctpartnersforhealth.org, and you can also enter to win 2 tickets to the conference plus dinner on the Connecticut Style Facebook page. And Dagmara, thank you so much for joining us.
Thank you, Jocelyn.
Coming up next, Teresa is in the kitchen with Taylor Greenberg, and they're making granola breakfast bars. That's when Connecticut Style returns.